What's up, everybody? Welcome back. Today we are going to go through why your body is lying to you. Happens all the time. We think that we have something going on somewhere and it is from somewhere else. A lot of times this is referred pain. Easiest way to think about this is when somebody is having a heart attack, one of the big symptoms is going to be left arm pain. The left arm is fine. There is no issues in the left arm. It is the heart. The heart's having the issues, but the pain is going to be into the arm. This happens, same thing throughout the body. One of the other biggest ones, sciatica. Sciatica is going to be one of those diagnoses that usually coming from somewhere else. It means the sciatic nerve, that big nerve that runs right down through the hamstrings, is aggravated. It's upset. It doesn't tell you why it's upset. It doesn't tell you what it is from. It just tells you that the sciatic nerve is upset. A lot of times that is coming from the back. So if we have pain that's going all the way down, this is where the pain is. The problem is typically up here at the back. Could be a disc herniation, could be nerve root impingement, could be piriformis syndrome as well. Could be a lot of those different things of where that nerve is getting hung up that we can try and fix the cause of the pain, not where we feel the pain. A lot of times that is the biggest issue, is somebody will be going after the calf, going after the calf, going after the calf. Doesn't change, doesn't feel any better. Typically that is because it's coming from somewhere else. You see this a lot with the shoulder as well. Typically right out here on that outside part of the shoulder, it's gonna be painful. That's not where the problem is. Deltoid out here rarely gets injured. There's rarely any big issues out here at the deltoid. It's usually going to be somewhere in one of those little rotator cuffs. One of the joint capsule nerves is getting a little irritated and it's sending some signals around to that side of the shoulder. That is going to be where that referred pain comes in, where if you just work out here on that shoulder, it's not going to resolve anything. It's not going to get anything better. So if you're having any of those issues where you're feeling pain, feel like you've been working on it, feel like it's not getting any better, start looking somewhere else. Typically, it's going to be coming from above that, especially if it's nervy. Any of those nerve symptoms where it's kind of dull, achy, sharp, shooting, stabbing, all of those are going to be nerve symptoms. So if you have stuff going down the arm, check your neck. You have sciatica going down the leg, typically it's going to be from the back. There's a lot of those different places where we see that referred pain, especially coming from the spine. Any rib stuff that's coming across, typically that is going to be nerve stuff that's going to be more central along that spinal column, as opposed to where you actually feel it out in those different places. So one of those big things, make sure you look somewhere else if you're having pain. Make sure you're assessing above and below. If you have knee issues, check your hip mobility. It's going to be one of those big issues. If the knee is having a lot of rotational stress, a lot of forces, that can cause issues. But the issue with the movement is going to be at the hip. So make sure that you look other places in the body. Your body lies to you all the time. It is one of those common things that it doesn't mean to, but you need to know kind of how to use that different kind of diagnoses types of things and just see where you're at within your motions in your body to try and figure out and fix the pain that you have. Hope this helps get you on the right track. If you are having any issues with referred pain, make sure you look somewhere else. Hope you enjoyed this video. Make sure you like and subscribe to our YouTube channel so we can keep bringing you videos, keep you living an active and healthy life.